So here is a radiograph. It is a contrast radiograph of thoracic region. Okay, it is lateral view. This posterior part is the vertebral column. Just in front of the vertebral column we can see a white shadow. It's a tubular shadow. So in the posterior mediastinum, the tubular shadow is caused by this esophagus. Here the contrast agent used is barium sulfate. The dye used is barium sulfate. The patient is asked to swallow the barium sulfate paste, and when the person is swallowing, the X-ray technician will press the button so that they can visualize they can take the image of this esophagus. Whatever is visible now is the luminal architecture of the esophagus, this tubular structure just in front of the vertebral column, and over here lowermost end we can see the diaphragm, and the food from the esophagus is ending up in a J-shaped organ called a stomach. So this radiograph, which is there to visualize the esophagus, is termed as barium swallow, where barium sulfate paste is used as a contrast and esophagus is visualized. Normally in a plain radiograph, esophagus is not visualized, therefore we do contrast radiography. This radiograph is not done for every patient. It is done only for individuals who have got dysphagia, that is difficulty in swallowing, odynophagia, that is painful swallowing, or any defects of swallowing, maybe discoordination, you are suspecting achalasia cardia, indigestion, or gastroesophageal reflux disease, and also in cases of suspected esophageal carcinoma, smoking and alcohol history. So all these cases, whenever you suspect a patient to have an esophageal dysfunction, even to note esophageal web in case of severe iron deficiency anemia called as Plummer-Vinson syndrome, we do this radiograph called as barium sulfate based radiograph. It's called as barium swallow. So when you are swallowing, the food is there when you are chewing, the food is there in mouth. When you are swallowing, the bolus of food is there in esophagus. When you have the meal, the food will be there in stomach. So this radiograph is called as barium swallow. It is depicting a tubular organ in the posterior mediastinum called as esophagus. If at all a tumor is there, then there is sudden narrowing of the lumen of the esophagus. If at all ulcers are there, okay, rupture of the esophagus is there, we can see spilling of the dye. Thank you for watching and learning from Logic Medico.